Welcome back to Torn. I'm Dr. Mark Wygand. I'm a board-certified sports physical therapist, and the goal of this channel is dedicated to the education on the ACL. In this video, we're going to take a step back away from talking about the ACL and dive deeper into the anatomy and structure of the knee joint. In order to understand what these ACL and more complex injuries at the knee entail, we have to understand what's going on at the knee. Amongst these structures in the knee, we have bones, ligaments, cartilage, all working together to allow movement, but also stability. So let's dive deeper into the structures and anatomy of the knee joint. Before we look at some of the specific structures of the knee, the first thing that we want to do is orient ourselves to the joint. So what I mean by that is this. The knee itself, so this is a right knee, the knee itself has a lateral side and a medial side. The lateral side just means that we're moving away from midline. The lateral side is the outside of the knee. When we look at the medial side just means that you're going closer to midline. The medial side is the inside of the knee. So when we look at anyone's knee itself, we base some of the structures inside the knee based off their laterality, or meaning the outside of the knee or the inside of the knee. So the first structures that we'll look at the knee joint are the bones. So what bones make up the knee joint? There are 4 bones that surround the knee, 3 of which actually form the joint itself. So let's dive deeper into that. The first bone that we'll talk about is the femur. So the femur sits on top of the joint itself. The femur is the largest bone in our body, also known as the thigh bone. Down here you have what's called the tibia, or the shin bone. So at the bottom of the joint where the femur sits on top of, that's the tibia. If I open this up, there you'll see what's considered the kneecap or the patella. The kneecap or patella sits in this groove on the femur. So if I open that back up, you can see where the kneecap sits right in that groove. On the outside of the knee, or the lateral side as we discussed, is what's called the fibula. The fibula is not considered a part of the knee joint itself. It's separate, but we do have structures that attach to the fibula, ligaments and muscles. As I mentioned, the femur is the largest bone in our body. The thigh bone here starts way up at the hip and comes down and forms the knee joint itself. So the joint that the femur forms with the tibia is called the tibiofemoral joint. Below the femur is the tibia, or the shin bone. So the tibiofemoral joint, where those 2 bones make contact, this is the tibia. The tibia serves as the more weight-bearing bone of the 2, meaning that most of the body's weight travels through this bone. The top of the tibia, or the tibial plateau, is a flatter surface that allows the lateral condyle of the femur and the medial condyle of the femur to sit nice and neat on top of that joint, which allows a nice smooth motion as we do different activities such as walking, running, cutting, jumping, all these different movements. The last of the 3 bones that comprise the knee joint is the patella, or the kneecap. So if I flip this around, that's where you'll see the kneecap itself. This sits, like I said, within a groove of the femur. So the joint itself of the 2 joints that comprise the knee is the tibiofemoral joint, where you have the tibia and femur, but also the patella and the femur comprising the patellofemoral joint. So as we move or hinge that knee during walking, sitting, all of these different activities, you want a nice smooth motion of the patella itself. The patella acts much like a pulley in a mechanical system. So what do I mean by that? As you can see in this image, by sitting in the front of the knee, it increases the leverage of the quadriceps muscle that runs over the top of it. Without the patella, the quadriceps muscle would have to work much harder to extend the knee. The last bone that we'll talk about is the fibula. The fibula isn't technically considered part of the 2 joints that we spoke of, the tibiofemoral joint and the patellofemoral joint, but it is a structure that's very important as far as attachments for ligaments and muscles. So we don't see a ton of actual weight-bearing structure going through the fibula, but it does have attachment points to such structures like the hamstring and the LCL, which we'll talk about next. So the next structures of the knee that we'll talk about are the ligaments. There are 4 main stabilizing ligaments of the knee. There are other smaller ligaments that we won't talk about in this video. We want to talk about the main 4 that you'll see. So the main 4 stabilizing ligaments are the LCL, the MCL, the ACL here, if I open that up, and in the back you have the PCL. So first one is the ACL. The ACL stands for anterior cruciate ligament. Anterior just means in front of. So when we designate the joint itself, obviously we have the lateral side and the medial side, but when we look at the different ligaments, we also have the anterior side, meaning the front of, and the posterior side, meaning behind. So the anterior cruciate ligament is the ligament that's in front, and we'll talk about that here. So the anterior cruciate ligament is the ligament that's on my finger right now. Ligament just means that you're attaching a bone to a bone. So that's what a ligament is. The cruciate part of ACL, or the cruciate ligament, is that the fact that when we go to designate these ligaments, the ACL here and the PCL in back actually form a cross. So cruciate is just Latin for cross. So when we go inside the knee and look at these structures, cruciates are the ones that cross each other. The next structure is the PCL. So you had the ACL in front, the PCL is in back. So if I flip this around, there's the PCL. PCL stands for posterior cruciate ligament. So as I mentioned, posterior means behind the knee. So this is the back of the knee. Cruciate, obviously we mentioned it means cross. It crosses with the ACL. And ligament, again, means that you're attaching a bone to a bone. So the ACL and PCL attach the femur to the tibia itself, and that's what provides the stability within the joint itself. The next one we'll look at is the LCL. So what does LCL stand for? LCL stands for lateral collateral ligament. So if we go back to our orientation of the knee, lateral means we're talking about something that is going outside of midline. So the lateral side of the knee is the outside of the knee. So when we look at the fibula, or anytime we designate the knee, we look at the fibula, that's how we know it's the lateral side. It's a good tip for you to understand how you're going to orient yourself to the knee. So the lateral collateral ligament is this one right here, right? So as I'm pointing to the outside of the knee, the lateral collateral ligament attaches the femur to the fibula. So it's another important structure, as I mentioned, of something that attaches to the fibula itself. The last of the four main stabilizing ligaments is the MCL. So you had the LCL, which is lateral. The MCL, as you guess, is the medial ligament. So M meaning medial. So the medial collateral ligament, collateral just is Latin for side by side. So you have these two MCL and LCL running side by side. Collateral in Latin just means side, as they run parallel down. So the MCL, or the medial collateral ligament, also attaches up at the femur, but instead of attaching to the fibula, attaches to the tibia itself. So the last structures of the knee that we'll talk about are the meniscus. So you have bones that make up the joint, you have ligaments that help add stability to the joint and structural soundness, but you also have the meniscus. What do the meniscus do? Well, first and foremost, the meniscus are what sit between the joint itself. So you can see the meniscus here. You have a medial meniscus and a lateral meniscus. So going back to orienting ourselves to the knee, this is a right knee, lateral side. You can find the fibula is always on the lateral side. The lateral side is where you'll see the lateral meniscus. So here, going back to the middle, you have the medial side, so the inside of the knee. There's the medial meniscus there. So if I open this back up, there's where you can see the meniscus. They're two kind of those circular or C-shaped structures. So what does the meniscus do? Well, first and foremost, it actually adds stability to the joint. It also acts as a shock absorber. So it absorbs high impact forces during walking, running, jumping, cutting, all of these high level movements. It protects the cartilage from excessive pressure. The last thing that we'll talk about what the meniscus does is it actually helps with load distribution. So one of the big analogies that I like to use for this is think about if you're sitting on an aluminum bench at a football game versus a pillow at a football game. As you can see in the image, what the distribution of forces helps with, this is what the meniscus does. So instead of having that immediate pressure or focal pressure on your sitting bones or muscles, what the meniscus does, or similar to that cushion, it actually distributes forces or the pressure away from one spot. So when we land, jump, cut, all these different higher level movements, the meniscus's job is to help disperse that pressure to even it out throughout the knee, so you're not having one spot on the knee that's getting all of that load. As you can see, the knee is a very complex joint. So you have bones, ligaments, the meniscus or cartilage making up the knee joint, which allow a lot of stability, but also a lot of movement. So it's important to understand the different structures of the knee, so when we look at something that's injured, we have a better understanding of where it is and its job. In future videos, we'll talk about the muscles that surround the knee and attach to the bones that we've just discussed. As always, if you found this information helpful, like, subscribe, share with those who might benefit from this education, and we'll catch you guys in the next video.